Aloha. Welcome again. Um, Dr. Albert Lin, the traveling doctor. Saying hello again. This is the April 9th COVID-19 podcast. I had to check on this again with the date. Like a lot of you guys, I have been losing my sense of time and dates. If you've been like me, hello to everyone joining in, Aldora, Lindsay, Lady, Daniel, everybody. So I'm going to kind of do it like last time. I'm going to do a little bit of the news first and then go into the drugs. I don't want to, I'm going to try to keep this again under an hour. And a lot of you guys have just been glued to the news like me. So I think you're probably seeing a lot of the same stuff I am. So I'd rather spend more time taking questions later because it sounds like there's a lot of questions. I've gotten a lot of questions about all the different new methods of avoiding this, new drugs. What I love about, COVID-19 and health stuff is that now everybody, hi, Michelle, welcome. So everyone's, again, joining me on Instagram Live, on Facebook Live. I will have these up on YouTube saved every day. And again, it'll be Monday and Thursdays, 1 p.m. Hawaii Standard Time. Hi, Michelle. Welcome. So, COVID-19 Daily Update podcast. Oh, one quick announcement. I've been working all week on a telemedicine app or website. So I'm going to be starting to do telemedicine consults. So if you need a sick note, if you want to talk about COVID-19, if you need official medications for pretty much anything, it'll be an online medical practice. So if you're interested in it at all, you can sign up to get some information at, again, www.thetravelingdr.com. And I'll let you know when it's live. I should be going live by next week, but I'll be getting back to work next week too. So it's not going to be every day, but I'll let you know. I'll be licensed in the state of Hawaii, I think like Delaware, New York, Wisconsin, Iowa, Indiana, a lot of places. Because they just need a lot of help, maybe even Pennsylvania, Georgia. So if you have friends or family, I'll probably be doing that. So anyway, going back to, hey, what's up, Lori? Thanks for joining up. So again, the Hawaii numbers are not looking so bad. I'm gonna tell you, to be honest, it's really not that bad in Hawaii. We've had just a fair number of deaths, about 4 deaths. We've got about 442 cases. I'm sorry, 5 deaths. And most of those are all in the Oahu region. So we're doing pretty well as a state. We've definitely flattened that curve tremendously if you look at Hawaii. We're not going to run out of ICU or maybe just slightly short of ICU beds. We're not going to run out of hospital beds. The curves have all sort of come down a bit in Hawaii, and they're saying our peak resource use, if you look at some of my links on my caption for the video, are going to be generally, we're doing pretty well. We're going to peak mid-April. As you know, hearing about Italy and Spain, those numbers have kind of come down. So and New York is on its way down. They need less ventilators, everything else. So things are generally looking better for our first peak again. But Hawaii, there's still a lot of problems. We still have a lot of homelessness. We still have, a fair number of people in the hospital. I think we still have 40 something people in the hospital, but that's not that much. We have like 10 odd hospitals. So we have, maybe 3 or 4 people in each hospital, maybe a little bit more, maybe a little bit less. I can't, again, speak to specifics about my hospital, but let me just say I went into work to do some paperwork and just to get out of the house, and because I was getting a little cabin fever. Welcome to Alyssa coming in from Instagram Live. I think, I snuck a peek at our hospital, and we're not really that bad. Our hospital bed situation is actually pretty low, because here's the funny thing. Everyone is so freaked out about COVID-19, they don't want to go to the hospital for anything. So all your like pain medication people, all your like car accidents, all whatever, everyone's off the roads and no one wants to go to hospital. So actually in Hawaii and certain states that are more geographically isolated, we're seeing less hospital bed usage. And, we do have maybe COVID people here or there, but it's not horrible. So I'm not saying it's all over. I'm just saying certain states are doing better. And again, we're still waiting for our peak. We're on what, April 9th. So technically our peak is coming April 12th. And if that's our peak for the first bump, we're not that bad. Again, we're doing pretty well, all things considered. If you compare us to like the other states, we are doing very well. We're down near West Virginia, Wyoming, Guam, Montana, Nebraska, Utah, all geographically isolated states. Our curve is the most flattened per capita, not just looking at that curve of cases. Remember, you got to look at adjusted per million, population per capita. We're doing really well. Now, which are the states that are doing poorly? Again, the ones you've heard about all week long on CNN: New York, New Jersey, Louisiana, Michigan, Connecticut, Massachusetts. Those are the ones that are doing the worst by deaths. Hey, welcome to Jesse. By deaths and, everything else. Welcome to Heather coming in. So, all those states are doing poorly, but Hawaii's doing better. We're having a lot of like debate right now. Lieutenant Governor Josh Green is doing these daily updates. So from Hawaii, I would definitely check him out and make sure that you, go and follow up with him. So, Stefan says, my broadcast is competing with Dr. Fauci. Hey, yeah, Stefan, Dr. Fauci will be talked about for, decades. Everyone loves him. He's a 90% approval rating. So hello to Stacy, hello to Lori, hello to Marissa coming in from Facebook Live. So I'll get to Dr. Fauci in New York and all that stuff later. So there's a lot of like heads butting. In Hawaii, the heads that are butting are Lieutenant Governor Josh Green. And you may have heard Tulsi Gabbard, who ran for president but didn't do too well. She basically wants our head Department of Health fired, Dr. Sarah Park. She thinks that, our version of Dr. Fauci, which is Lieutenant Governor Josh Green, should run the whole show. And, I'm not saying that the Department of Health has been behind, but I think Lieutenant Governor Josh Green has done an amazing job. He's an ER doctor. He's a master of public health. And he's put down the best stats. He has a great daily update, way less time than mine. It goes about like 2 or 3 minutes, and he gives a great by the numbers update. So if you're in Hawaii, go to Lieutenant Governor Josh Green's site every day if you want to look at the curve and how numbers are doing. Again, Hawaii is doing really well. We're ticketing a lot more people. We've had the quarantine stuff in place for anyone coming in, any domestic, any international, into hotels. They're calling the hotels one time. You're not there, they call you second time. If not, then they're starting to give out stuff. I've heard about people getting tickets running, not just warnings anymore. They're getting tickets running around the parks and stuff if they're not just doing the normal exercise. Now again, you can run in motion. You can be walking through the beach and walking along the beach and running along the beach and going straight into the water. You can't be tanning on the beach, reading a book or everything. LaShawn, welcome LaShawn coming in on Instagram Live. Again, Hawaii, and again, there's always that debate about the surfing. I haven't personally surfed since my last podcast. I may go, but again, that's debatable about spray and all these other things, and how close you're in the water. Again, I also went to Costco on the way back, and many of you guys know from my Facebook update, I went very, very late. Like, I don't need toilet paper. I don't need all this paper towels and cleaning equipment and trying to get hand sanitizer or whatever. Like, I think again, a lot of people have enough. Now I live solo, so I understand people, big families, and want more stuff and go through a lot more toilet paper. But I went to Costco at the very end, literally 5 minutes before it closed at 6:30. And I know I'm a healthcare worker. I can skip the line if I want to, but I don't want to abuse that. And I don't need to. So right now I went right before the end, and I got everything was there that I needed for food. It was mainly food. I wanted to stock up on chicken and salmon, and what did I get? I don't know. Like peppers and Brussels sprouts and, a ton of eggs. I go through a lot of eggs. I'm sure a lot of you have gone through eggs, and a lot of you are lacking certain things like flour and yeast and whatever. My point is, Hawaii's, we're doing pretty well. I do see still a decent amount of cars on the road. There's no traffic really. And I think every restaurant is still closed. So what does that mean for us? People are still getting takeout, but I think my prediction is Hawaii is going to extend the stay-at-home thing until mid-May. I really believe that. I mean, if you look at Europe, some of them are saying that they're going to go until like August. And they're ahead of us. If you look at Spain's curve, Italy's curve, they're on the downside of the curve. That's why a lot of people are pretty happy. They're on their downside. And New York is peaking. If you look at New York, it's peaking. I have to look at the actual map of stuff, but it does appear to be peaking in New York. And so everyone is pretty happy about that. So again, I think, Hawaii is doing better. I feel generally like I will need to not worry about stuff as much. ICU beds in New York, they look like they're meeting their need. Oh no, I'm sorry. They still look like they're a little short in New York. They only have they're very short, and they're short in ventilators too. So I mean, but the point is that they're on their downside, and as you know, New York got hit very, very, very hard. So that's Hawaii. And again, I feel pretty good about it. We will kick our curve. And we'll come down. But as everyone wants to know, when are we going to go back to work? When are we going to socialize again? When are the restaurants going to be open? When can we do stuff that's just not at home? And again, I'm saying that at least from what I see in America, and again, New York will be first, and then all the other better states that are doing really well, like some of the Californias, the Hawaiis, whatever, we will reopen certain industries. And I really think that has to do with the antibody test, the IgG, IgM test. Now, one update about Hawaii, I found out we got that new rapid test, the Abbott Laboratories test. Now, a lot of the states are getting them, but it's that quick 5 to 15 minute test you all heard about, but it's not the antibody test. My LA friends, some of them have gotten antibody tests, my friends' friends. They have an actual antibody test from again, University of Pennsylvania. I think Stanford's doing one, and Sean Penn's social, awareness kind of charity group has been doing free antibody tests in IgG, IgM in Malibu, and I think Westminster down in Orange County. So they're available, but they're just not very available. Even the Abbott quick tests in Hawaii, they only have the ability to do 250 tests a day. I mean, you think about it, that's really not that many tests, right? Like, that's not that many tests at all. So I don't really know what is going to happen from that. And we need to test more, but we really need an antibody test, okay? So, again, a lot of airlines have been canceling stuff. They're starting that Hotels for Heroes program where doctors and nurses can come in and stay somewhere else and not infect their home. And again, I hope after the last 2 podcasts, some of you have been doing that the decontamination area. Again, taking off your clothes, wiping stuff down, just going naked into your shower after you decontaminate all your shopping stuff, your keys, your wallet, I don't even bring my wallet out anymore. I only bring certain credit cards and, your phone and all the things you shop for. And then you wash the rest, you take a shower, and then you can greet your family, do everything else you want. I mean, I've been doing that a lot. And hello to Linda coming in on Instagram Live. So the tests are going quicker. All these convention centers, the Hawaii Convention Center, Blaisdell, the stuff that we've put in advance, I don't know that we're really going to need to use them, but, it's a good plan to have. So basically what I'm saying is Hawaii is doing pretty well. U.S. update, it's still pretty bad, as many of you have seen. We are at a lot of cases. We're at almost 500,000 cases in United States. So that is up from 364,000 cases like just a few days ago on Monday when I did this. And we've got almost 16,000 deaths. So that's officially, we have the most deaths in the world compared to Italy and Spain. But again, you're not supposed to look at, obviously we have way more people than Italy or Spain or Germany or a lot of Europe together. So you have to look at population adjusted. And again, New York has tons of deaths. We now have double the amount of 9/11 deaths. But again, we have so many people in New York. Still, population adjusted cases and population adjusted deaths, New York is still the worst in the country, at least. So that's that. And again, New York, it's hurting. They're hurting really bad. My friend, again, has taken care of 40 people in his ICU in Long Island, COVID-19 patients. And he's got some very disturbing data, all the stuff that people want to know about, the hydroxychloroquine. People get put on that right away. And he's finding that a lot of these people are still going to intubated. And hi, welcome to Emily coming in from Germany, I think. a lot of people are wanting hydroxychloroquine to work, and he's seeing that these sick people, let's call them minority people who are overweight, diabetes, kidney failure, other things. Once they get ventilated, again, the numbers look really bad. It's anywhere from 50 to 85% of people who get ventilated die. That means you have less than half or 50% chance, a coin flip chance of living once you get ventilated. So it's pretty disturbing. My friend says his numbers are even worse. They're worse than 85%. They're like maybe almost 100%. But again, the richer, skinnier white people who are in Upper East Side Lenox Hill, which is a very rich hospital, are doing better overall. And they're getting some of the more advanced drugs, the acetemra. And I'll go into a lot of those drugs coming up because I want to focus on some of those things and theories and whatever. Now, again, people are doing better overall in New York, and they're trying to figure out how to open up stuff still. So what are they going to decide? Look at New York. What New York does is going to speak to us as the rest of the country. Remember, they're ahead of us. Ahead of us isn't they got hit worse, and a lot of us are getting not hit as hard unless you live in New Orleans, Louisiana, and again, like Detroit, Michigan, Chicago, Illinois, and New Jersey, some of those bad places. But if you're in another state that's not those places, then you're probably in a state that's not doing too poorly, and you probably see a lot of people are not taking this that seriously. So again, New York is still hurting. They're still trying to get a lot of people, nurses, doctors. And again, I at one point thought about going to help them. Maybe I will someday still, but I think the best way I can do is telemedicine. And they are still paying crazy amounts of money to nurse practitioners and doctors also. And sadly, there are doctors that are dying. I've heard a bunch of doctors in New York died. Medical residents who are young have died. There's one of my friends who's an ER doctor in Hawaii. His trauma surgeon who trained him in New York, a trauma surgeon who was a foreign graduate, he was older, unfortunately, a minority. I don't know that has anything to do with it, but certain things, he was just older and maybe looked a little out of shape. He died. So doctors are dying of this. It's not as much as like, I think Italy has like 80 doctors died and like 30 nurses died and whatever. But, still people are dying. So it is really sad. You may have heard in New York that people are getting sick even on the COVID-19, the Mercy ship, the US Navy ship. They're having positive cases in employees, and they're starting to take COVID-19 patients when originally they were supposed to be overflow. So let's see what happens in New York. Let's see how they reopen again and do different things along those lines, okay? And again, California is doing better, so I'm not going to go into it. I'm a little worried about my parents. They're in a retirement community, and we didn't have any cases there for a while. They were really all paranoid, but now apparently there's like 6 cases. And just in my parents' community, that's a decent amount of cases in just one small little neighborhood. It's almost would be considered a cluster. Before I forget, I got to mention, in Hawaii, they have a cluster in Maui. The major hospital there, Maui Memorial, has like 15 employees, 15, that are all sick from COVID-19. So that's concerning because these are all the people taking care of everyone in Maui, in the hospital. I don't know that they got sick in the hospital. They're trying to figure that out. Maybe they got sick outside and then came in. They say a lot of them are related to travel. So what's the number one risk factor that's going to affect you to get COVID-19 right now? Travel. They saw that for people coming in. Most of our cases are travel, bringing it back in from Hawaii to Hawaii. Like Hawaii doesn't have that much. And welcome to Phil coming in from Vegas. I think my point is, if you travel, even when we release travel restrictions to Hawaii, other places, that's your number one way you're going to get COVID-19 if you don't have it already. It's travel, even domestically. Forget about international. I know a lot of countries are not going to let Americans come there for a while. I'm not planning to travel internationally for a while. Stacy, yeah. So Stacy, I heard there's a rumor in Maui Memorial that they're saying employees aren't allowed to wear their own masks, that they have to ration them and wearing them for a week or whatnot. So I don't know what's true there or not. I'd have to talk to my friends at Maui Memorial who are doing stuff. And again, I don't know how much they're allowed to say because they're worried about getting fired, right? Like nurses and doctors are. So, I don't know what's the truth. The truth is almost every hospital, every nurse, every doctor I've heard of has had to ration masks at the very least. Like use the same surgical mask for a while, if not a couple days, if you're not taking care of COVID-19 patients, and use only one mask that you reuse and put in a bag, like an N95 mask, for COVID-19 patients, unless you're working on a whole COVID-19 ward or whatever. So literally, I haven't heard of one doctor or nurse that hasn't had to ration. It's just how much have they had to ration? Marissa mentions, is it true that most of the cases from Europe and not Asia with the genome mapping? Aloha to Brad coming in, my old high school buddy. Welcome to Brad and Marissa. So Marissa, yeah, I'll mention that in relation to this update with New York. And again, you all wondered, well, why didn't New York get hit first? New York is a big city. It's international. Of course, everyone's like, oh, well, it was all the Chinese. They flew in, and anti-Asian stuff. You may have seen a lot of those subway videos. I saw really horrible stuff like veterans and people wearing masks saying like, thanks a lot, chinks. Like literally, like horrible stuff like that. So everyone's blaming China, and China is to be blamed for a lot of stuff, legitimately. But Marissa is right. They are showing genomically. What does that mean? By genetic code, there's slight differences in the strain. The strain from China is different from the strain from like Italy, which is different from the strain from Iran and whatever. And what they're seeing is actually most of the New York cases are, especially all the New York City cases, are all from Europe, from Italy and Spain. So if you want to blame anybody, and you shouldn't, it's the Italians and the Spaniards and like the people from Europe who've come in. And geographically, it makes sense, right? New York is on what? The East Coast. They're way closer to Europe. And they have a lot of Europeans come in to travel just for tourism, other things. And a lot of them were asymptomatic, and they didn't shut down as quickly as California. So my point is that most of the cases we're seeing, maybe even nationally they'll figure out, are not from Asia. They are from Europe. So, this is all data in the making, and those are prelim results. So Marissa is right. So maybe we'll see that. Even in Hawaii, maybe, again, Trump might have saved us by shutting down China flights right away. And so I would be curious where our cases are coming from. From what I understand in Hawaii, all the Hawaiian cases are coming from not even tourists, because all the Hawaiians don't like tourists now. Some never ever did. Welcome to Amanda coming in. And, all the cases in Hawaii were from Hawaiians traveling where? Back to the US and bringing it back with their cheap flights from Vegas and California, whatever. And a lot of those may have been European cases. So that's the national update. Again, generally, me and my friends are very worried about the southern states and minority states. Louisiana, I've talked about this for weeks. I'm not making this up. And they're getting hit hard. New Orleans is I think the third or fourth worst city right now. So let's kind of keep a prayer for them. Again, I really recommend anyone, this is Good Friday and Easter weekend coming up. Please do your religious stuff remotely. Andrea Bocelli is singing, and I'll get into that. He's got a free concert coming up on his YouTube page, I think tomorrow. So it will be our Friday, their Italy Saturday. He's going to broadcast a live concert. I'd love to see Andrea Bocelli. I'm going to record that stuff, because it's Andrea freaking Bocelli. So, and again, going to so that's the US, and going to the world. So Stacy asked, what strain is it for Hawaii? Stacy, I don't think they've done the genomics yet, but I would guess, again, they said it was travel from the US, most of the cases. So my guess is most of those cases are also from Europe, not Asia. And again, I'll get to Asia right now because we're starting to see some cases creep up. So Francis says Chinese were in Washington and Europe, Iran, in New York. Yeah, that makes sense. So as you know, if you know most Chinese, there's a theory that a lot of like Californians and people in LA and San Francisco and Seattle were getting sick earlier. Maybe a lot of people, everyone's asked us, oh, I got really sick early, maybe even November or December or January. A lot of people ask me that. And as you know, I got really sick, probably the sickest I've ever been from a pneumonia in February. And they keep pushing back the date. Again, China, they're lying about some stuff or maybe fudging over the numbers. So when did they discover it? Did they discover it in end of December or mid-December? Now they're saying middle November they figured out. So it's possible. And Chinese were flying everywhere, but mainly Chinese fly to where? Where do they invest in property? In Vancouver, in Washington, in Seattle, in Los Angeles, San Francisco. I mean, yeah, they do go to New York, but generally they go to the West Coast and they go to Hawaii. So maybe we've been exposed to. Again, we haven't tested enough to know who's positive and who's negative. Again, we have a lot of false positive or false negative tests, so we don't really know. So good point, Francis. I believe too, Chinese geographically went to where? The West Coast. And Asians went to the West Coast. I mean, that's where a lot of their property is and their investment. And a lot of Europeans went to the East Coast in New York and they slammed them higher. Unfortunately, New York City's heavy density. So world update, again, the world update is pretty crazy right now. I think, again, as I understand it, the world has a lot more cases. We're up to 1.34 million. Last time I talked to you Monday, it's 1.6 million right now. And again, we have the most cases, followed by Spain, Italy, Germany. But here's the thing. So everyone's like, oh, the US screwed up, right? The US really messed up and we are horrible and, you know, so-and-so and Trump screwed us and the CDC screwed up or whatever. But actually, if you look at case adjusted by per capita, a lot of other countries are not doing as well, you know? Again, a lot of other countries are doing poorly per capita. And for example, one of the countries is like Luxembourg is doing really poorly because, you know, they have a very small country. And so a lot of them tend to be a little bit more sick. So Luxembourg, actually Iceland tested a lot, but per capita, they have more cases than we do. They have like 1,648 cases, not that many, but for their country, their size, they only have, I don't know, they don't have many people. They're the size of England. And I don't even think they have as many cases or many people as like Hawaii does. They have the population of Hawaii in the size of England. So Iceland's doing poorly per capita cases. Spain and Italy are doing worse than us. So, you know, everyone that says US is doing poorly is just looking at gross numbers. They're not looking at per capita cases or per capita deaths. I want to bring up something everyone has been talking about with me that's going viral, okay? And welcome to Sam. Yeah, Amanda says good tax breaks in Luxembourg, but it's a small city, so not doing well. And so I want to, yeah, so Neil mentions he also got sick in Amsterdam in January. So Neil, you might have COVID-19 or you may have the antibodies from it. We don't know. And Brad says, do we know the positive and negative predictive value of PCR? Brad, I have to look at that and I have to do basic stats because I know the false negative and they have the sensitivity and specificity of the PCR test, the main one that everyone's using. I have to look at those numbers. I don't know that yet, but I know the false negatives and the sensitivity is not very good for the PCR. The antibody test will be the big killer, that one. And then Allison also mentioned she got horribly sick in November. So again, all of us who think we got really sick the last couple of months, let's say from November now, traveling everywhere around the world, because I know a lot of you guys travel everywhere. You've gone travel in Europe and Brazil and, you know, the Maldives, you know, like me, you know, South America, Africa, everywhere, even just New York and all over the world. So I can't tell you whether you had it. The only thing that's going to tell you, even to be honest, right now, if you're not having many symptoms, if you get a PCR test, that won't tell you. Why? Because that's based on viral PCR and loading. You know, if you have a high amount of virus stuck up in your nose, then you'll get it. But you'll come out positive, ideally. But if you don't and you're not symptomatic, it won't tell you about your antibody status. It won't tell you about your IgG, IgM status. So one thing I was going to talk about UK and Great Britain again. But again, my point is the #1 article, I know all you guys have seen it, Sweden, right? Oh, everyone's like, Sweden, they're doing herd immunity. Everything's great in Sweden. It's not. Go to that Worldometers statistics and adjust it on your vertical column. Total cases per 1 million or per capita, or total deaths per 1 million per capita. Look at Sweden. Sweden's doing worse than the US. Sweden for deaths is actually doing worse than the rest of Scandinavia. They're doing worse than Norway, worse than Denmark, worse than Iceland, or not worse than Iceland, sorry, worse than Norway, worse than Denmark, worse than Finland. So the point is Sweden's doing okay, but they're not doing better than everybody else. People who write these articles don't know statistics and they don't know adjusting by population. And yeah, you know, Sweden doesn't have as big cities as New York City and other, like Stockholm, I don't know how many of you have been to Stockholm, but it is not a Madrid. It is not, a Rome. It is not a Milan. It is not a New York City. It's not super packed. So yeah, Swedes may follow more rules, kind of like the way that Germans will follow rules, but like it doesn't mean that they're necessarily doing better and that that's proof that it's herd immunity. So I've gotten that article forwarded to me like 10 to 20 times since I talked to you guys. Everyone wants to say, oh, they want to hold out hope that we should just all go out and get all the... I believe in herd immunity. Let me be clear. But I believe in herd immunity as in like we test all of ourselves for IgG, IgM, especially the younger people, especially the people who need to get back to work, healthcare workers, essential workers, restaurant workers, grocery workers, EMTs. I believe in that. And if we are all positive, meaning we've recovered, we have IgG, we had all that sicknesses from like months ago or 2 months ago or 1 month ago, and we're fine, then I believe in sending those people out. 100% I believe in that. But we don't have that. So to assume that we just throw everyone out there and everyone will be okay, like Sweden, no. So everyone who says Sweden is doing a great job, tell them to listen to this podcast, okay? At minute 30 on this podcast for me, or minute 25, okay? So Neil said he took the COVID test a week ago in LA and it came back negative. Neil, did you take the PCR test, the nasal pharyngeal one, or did you take the IgG, IgM? I think you mean the PCR, so it's tough to say. I guess it was negative, but I don't remember what kind of symptoms you had. And Phil also mentioned that he got sick from a coworker and he's on a ventilator. So again, it's tough. But again, so Phil, I would say maybe if you were sick when you got the test, it might come back positive. But again, I told you this PCR test is 30% false negative. That means out of 10 people testing negative, 3 of them were actually positive, but the test said they were negative. That's a horrible statistic. That's a horrible test as far as I'm concerned. It's great that we're testing thousands and thousands now, but that's not great. Marissa says, what do I think of the new CDC guideline for ability of essential workers to return to work after coming in contact with a COVID positive patient? Marissa, I think that's a great idea. That's why I'm talking about the IgG, but you cannot just tell essential workers to go into work if they're COVID positive and think that they'll be fine. I mean, yeah, they can wear surgical. If they're asymptomatic, maybe they're fine, but you're taking a chance. So what do I think about CDC guidelines? Marissa, if you listen to all of my podcasts before, you know what I think about the CDC and the World Health Organization. They are behind the ball. They're just trying to keep workers out there and make a recommendation so that the healthcare system doesn't shut down, right? Because if every hospital system had to send a healthcare worker home if they came in contact with a COVID positive patient, half the hospital would be out. Almost all of New York would be out, right? So they cannot say that, So they want to say, oh, well, you can still go to work until you're starting to get symptoms and then you get tested. I mean, it's kind of ridiculous. I think they should only recommend it if that worker tests negative for PCR COVID-19 or IgM, even better. But again, we don't have those tests available right now that easy. So that's what I think. And Phil, yeah, so it's hard. I don't know, man. If you think you got sick around the same time as your sick coworker who's intubated, then I would get that test if you were still symptomatic. But it's hard because, another thing before they were saying, and even the CDC was saying, and Marissa, this is why I don't like the CDC. Before they were saying, oh, you don't need to test asymptomatic people. But that's because there weren't enough tests. The CDC and the World Health Organization does their guidelines based on what they think will create the least chaos in society because they're worried about people hoarding masks and people hoarding hydroxychloroquine, which I'm going to talk about in a second, and people hoarding, now tests, PCR tests. But guess what? California and Hawaii, they're all recommending that we get tests even if we're asymptomatic. So in other words, California and Hawaii disagree with basically the CDC, And hello to Maria joining in, I think from Norway. So Maria, I talked a little bit about Norway versus Sweden a little bit a while ago. So you can watch that earlier part of the podcast or the Instagram Live or Facebook Live. And everyone's thinking Sweden's doing a great job. I told them that it's not necessarily true. Norway and Denmark are actually doing a better job than Sweden. So my point is that the CDC is behind the times. Who do you want to listen to? A state like California and Hawaii that's doing a really good job, or the CDC and the World Health Organization that are constantly readjusting all their guidelines and are not as strict and constantly have to change their mind. I mean, look, I'm a doctor and I respect the CDC and World Health Organization on some level and the job they do, but they messed up. Big time they messed up. It wasn't just Trump. There's a lot of blame to go around. China has the most blame, I do believe that. And then the World Health Organization and the CDC have the number 2, number 3 blame. And yeah, I do blame Trump on some level. But as I mentioned, he blocked China from coming in, and that probably saved a lot of the West Coast. Honestly, I have nothing to prove that, but I really believe that. One of the things I think, so Neil got the swab in the mouth. Again, Neil, look up the sensitivity and the false negatives for the swab in the mouth. They're even worse than the nose swabs. They're even worse, okay? What's up to Mike Elena? Mike, welcome in on Facebook Live, another old high school buddy. So everybody, again, you're welcome to share this to your family, friends. I'm going to try to keep it under an hour this time. We're already at 35 minutes. I don't know if I can do that. So the rest of, again, the other big article I got, so that was Sweden. The big news was UK, Boris Johnson. He's been in the ICU for 3 days now. And all my friends are like, is it a conspiracy? Is he doing poorly? Is he doing what? I mean, again, if you don't believe what the English government is saying, then you're thinking he's really sick and might die. Agnieszka, welcome. Thanks. She's from Singapore, my friend Agnieszka. Again, I have friends from all over the world checking in. And they Singapore is doing a good job. But again, I'll talk about Singapore and China and Hong Kong. We're worried about the second bump coming in. But they are reopening on some level. But again, I think Singapore is still very strict. So UK, Boris Johnson has been in the ICU 3 days. He's on oxygen. He's not on a ventilator. Remember what I said about the ventilators before? People on ventilators have a really bad chance of living, not even getting off the ventilator. In the statistics in the US, they're seeing 50% survival rate up to 85%, or 50% death rate up to 85% death rate in Wuhan, China. And again, my friend in a bad, very sick hospital has 100% death rate. But Boris Johnson, if you believe the British government, he's not being ventilated. I mean, he's a very VIP, so they're watching him very closely probably and giving him all the fancy drugs probably, which again, I'll get into. But he apparently is not ventilated. So again, I really hope he does better, okay? So 4 days. Oh, Danielle gave a great update, Danielle from New Zealand, which is doing a great, amazing job. You may have heard New Zealand is one death, and they're very, very strict like certain other countries and even certain states like Hawaii. Again, I believe Hawaii is doing the best and the most strict state. And again, obviously New Zealand is maybe the strictest country right now. So Boris Johnson, she just said, has been released from the ICU. That's good news. So, good job, good show, as they would say. Jolly good show, as they would say in the UK. But Mike Elena mentions, as I mentioned, I believe Boris Johnson got everything probably under the sun. He probably got not just hydroxychloroquine and azithromycin. He probably got IVIG plasma, right? Again, rich people drugs. He probably got Remdesivir and acetamra and whatever. So let me go into hydroxychloroquine because people keep asking about hydroxychloroquine. And again, I want to reiterate the tests and the studies that have done it. There have only been 2 real, early studies, and they were 40 to 80 person studies by the same French scientist who published it in the same magazine where he's a board member. And a lot of societies have basically said his data is flawed. So I'm not saying it doesn't work, but my friend Jameson from Shanghai gave me a new article. There's a Brazilian virologist that said he treated 300 patients with hydroxychloroquine, and he said all 300 survived, and he did really well. But his study looked at starting hydroxychloroquine early. A lot of these other tests may have not have done it. A lot of these studies may have started too late. For example, my friends all my doctor friends, we all put patients on hydroxychloroquine early, right? But we don't do it until they're sick enough to be in the hospital. So the argument is that hydroxychloroquine, maybe we should use it earlier. And I know CNN and the mainstream media and a lot of other people are like, well, you shouldn't use hydroxychloroquine, right? Because there's rates of eye problems and heart problems, and everyone is going to die if we're all on it. Look, a lot of my doctor friends are saying hydroxychloroquine is relatively well tolerated. If you adjust their minerals, if you watch their heart, if you give them enough magnesium, they shouldn't have heart problems. Generally, if you give them it for only 5 days, which is the normal course for hydroxychloroquine off-label, you shouldn't have eye problems. And again, people with lupus and rheumatoid arthritis take this all the time. They take it for weeks, if not months. So most of them don't have a problem. So the argument that we're all going to sort of have a problem with hydroxychloroquine is a false one. Do I think we all need it? No, I only think that early maybe COVID-19 patients. I do believe maybe like the Brazilian virologist, maybe hydroxychloroquine. Mike, I agree with you. So Trump may be right. I think I hate to say it, Trump may be right. He's a bad way of explaining it, but he may be right that we need to use hydroxychloroquine and possibly earlier. I don't have the data, but I think the problem is that as soon as you say we need hydroxychloroquine, everyone in the country will want to get it no matter whether you are sick or not. And again, we need to save it in the pharmacy and not just the hospital, but we at least need the pharmacies. In other words, I think we should be able to get to a point where we give hydroxychloroquine only to the COVID positive tested patients, right? The ones who get sent home and might still get sick. The ones who maybe we want to avoid them coming into the hospital and getting sicker is maybe hydroxychloroquine. There is some evidence to giving an outpatient prescription for it, but we don't have enough of it. And it's not that hard to make. Once we have millions and millions of pills, the problem is it may take a month or two maybe to make enough pills to give it to the COVID positive patients. I'm not saying I don't want hydroxychloroquine to be on the shelf at Sam's Club and at Costco and at Walmart so that you just get it and no one can find it who really needs it. Because we all know humanity sucks and humanity is bad at being a good person, at sharing it. They hoard it first and they donate it later. You cannot have that with hydroxychloroquine, and that's what I'm worried about with hydroxychloroquine. Funny thing, a lot of people have been like, I'm taking gin and tonics or vodka tonics, because what does tonic have? A lot of people don't remember this from history, but tonic water has what? Quinine. Quinine is what? It's the base element of hydroxychloroquine. I actually had to look this up. I'm like, I wonder if you can just drink gin and tonics and vodka tonics and maybe you'll be okay. Kind of like the guy in Arizona poisoned himself with aquarium cleaner. And you can't. Because guess what? By limit, there is only 63 milligrams. I looked this up, 63 milligrams of quinine in 1 liter bottle. And you know how much your average dosage is of quinine or something like that, or quinine compound when you take hydroxychloroquine? It's something like, I don't know, like 400 to 600 each day. So in other words, you'd have to drink more than 8 to 10 liters of tonic water in order to a day, which is ridiculous. So my point is, don't use quinine in tonic water to try to save yourself. Let's try to see what the evidence shows. I think there is a role for it. I think there is a role for hydroxychloroquine. I still hold out hope. I'll tell you where I don't think there's a role for. I do not think there's going to be a role for remdesivir. The first studies from Gilead, and again, remdesivir is one of the drugs like hydroxychloroquine and azithromycin and Kaletra and then IVIG. Those 4 drugs have been studied by the World Health Organization on the biggest study ever, the Solidarity Trial. So look that up. And again, remdesivir, the early data looks really, really bad right now. So my guess is remdesivir is not going to do well, and Gilead as a company is not going to do well, and it won't be a great drug to use. And again, it's way more expensive and harder to use and process and make than hydroxychloroquine and azithromycin, which is very easy. The supply chain is already there. The supply chain for remdesivir and Kaletra is not good. Oh, by the way, there's some new news. Pfizer company. You all know Pfizer from like other medications and Viagra and whatever. They apparently are saying that they may have a new drug that's an antiviral. There's no name for it, but they're saying that it's showing good promise. So look out at Pfizer. And then Pfizer is also saying they may have a vaccine out earlier. So there's a race to the finish right now. Johnson & Johnson, like a week ago, said that they may have a vaccine very early as the end of the year to early next year. And then now Pfizer, they're racing to the finish line. And I think Bill Gates Foundation is also saying that they may have a vaccine that may be earlier. And again, I got to warn you, once they have a vaccine, it's not like they're going to suddenly have 370 million vials of vaccine for everyone in America. It will be enough for the, probably the early, again, the most at-risk patients and the early, responders, the first responders, the ER doctors. Unfortunately, someone like me who has to have a COVID-19 patient breathing in his face all day long, the EMTs, the nurses, maybe even the grocery workers and all that. And welcome to Chai for coming in. So again, I think the vaccine, we may get it earlier than middle of next year, but I don't think we're going to get enough doses to treat all of the world society and all the American society even until the middle of next year, or maybe early next year at least, the spring of next year. But I think, that's the other rumor. I hate how all this like fake news stuff spreads around. Besides the new 5G rumor, now there's the rumor that Bill Gates, like Trump owns a financial interest in the company that makes hydroxychloroquine. Okay, that may be the case. Is he benefiting from it? Yeah, maybe he will. But does that mean he's wrong? No, I don't think it means he's wrong. The data is the data. If the data works, the data works. That's all I'm going to say. I'm a doctor. I look at realistic studies. And the same thing is being said to Bill Gates and his foundation. And again, he gave up all his wealth and he's trying to help out society. And he's done it for a lot of Africa or whatever. So a lot of people saying, oh, well, Bill Gates just wants to create his vaccine so his company gets rich and so that he makes all the money off the vaccine or whatever. Hey, listen, if the vaccine works, it works. If you believe some big, big, big world conspiracy that this was released by, the Illuminati and like all the rich people in the world and, the G8 leaders and whatever to like make the population less and kill off the sick people and all this crazy stuff and to somehow make Bill Gates richer from this, by having to use this vaccine. I mean, you're smoking a lot of stuff at that point, I think, or you are, doing a lot of and some other stuff in my mind. I mean, if you want to believe it, you believe it. I'm never going to be able to prove you wrong on that. The same way that you're never going to be able to convince me that this is the most elaborate conspiracy, like 5G gives everyone cancer and 5G gives everyone COVID-19. I mean, you really have to like not trust anyone in society if you're thinking that, It's really, really pretty ridiculous. And welcome to Sean coming in. So that's about Remdesivir and hydroxychloroquine, and that's also about the vaccine. That's the update. So what do I think? I still think, and this goes into a little bit more of a world update. Now, again, I told you how Europe is doing, and again, there's some places in Europe where it's illegal now to go out without a mask. It's not illegal yet in the US. They're suggesting it. Even Danielle, I'm not sure New Zealand, maybe you can answer for me if it's illegal to go out without a mask. I don't think it's illegal there, but certain cities, I heard in countries, I forget which ones in Europe are doing that. Oh, Paris also, by the way, is the first city in Europe to ban all exercise. They were still allowing people to run and walk and like run around the Eiffel Tower and run along the rivers there. They're not allowing it. And again, Hawaii is still allowing the surfing. I know it's very debatable. And they are still allowing running. So again, I want to talk a little bit about, so again, New Zealand going on again, they are doing very, very well. No outdoor exercising or water sports, no takeout, no lines in grocery stores. There are groceries and pharmacies, hospitals still open, but there's super strict quarantine rules. They are recommending that people are doing a domestic travel plan after this. New Zealand's going to be very, very strict because they don't want to mess up. They only have one death, remember. Now, they only have one death. They're probably about double the size of Hawaii. So they're like Hawaii, an island. So they had a lot of advantage. They're geographically separated. They tend to have a younger population, and the younger population doesn't get sick as much. So they're double the size of Hawaii, and they have 20% of the deaths. We have 5 deaths. They only have 1, and we're half the size. So that puts it relative to Hawaii. They're doing very, very well. But I think New Zealand will be very, very strict. Danielle can correct me if I'm wrong. They're not going to allow other countries to come in for a while. So again, after this is over, don't count that you're going to be able to domestically finally start traveling to the Maldives and go to Bali and go to Thailand and go to all the beach stuff. I know everyone wants to travel. So Marissa asked, because of the slipstream behind a runner. Marissa, I don't even know about that, but think about it. What do runners tend to do? Runners and joggers, when you go out together, you do what? You jog side by side, right? Like, I would even worry about breaths. Like, remember when you go out running when it's cold, what do you see? you see breath, right? You see people's cold breath in the air. And if they're huffing and puffing right next to you, and people train together, run together all the time, people run alone, but a lot of people run together. So I think there is some theory that how can COVID-19 be spread now? It's spread by breath, not just even airborne stuff, not just even whatever. That's why I don't like the CDC, World Health Organization. If I had my choice, everyone would wear a surgical mask outside, but they're just not enough. So I do worry a little bit more about running together than I worry about surfers that are 20 feet apart and maybe a little spray comes or whatever. I worry more about being 1 or 2 feet away from a fellow runner, even if it's a friend I trust a lot. I don't know where they've been and what they've touched an hour ago, you know? So welcome to Carlene and welcome to Dan coming in. Old Herrick's guys, it's great to see everyone on right now. And welcome to Natalie and Jay, everybody coming in. So welcome to the COVID-19 podcast. Thanks for checking in and welcome to Nicola. So going into, and again, I mentioned this, the BCG test again, right? The BCG immunity test is another therapy I talked about last time, which is very fascinating. Again, you can Google BCG COVID-19, test, drug, whatever. Again, the COVID-19 map, if you look at the BCG, and the BCG again is what? It's that, have you ever seen someone on the deltoid in a poor developing country, even China, India, whatever, they all have that scar. You've seen even younger people because they have tuberculosis in that places. And they're studying it. So I don't have the results. Australia, Netherlands, Germany, UK are all studying it. So maybe it'll be something, maybe it'll be nothing. Kind of like I think Remdesivir, there's nothing going on from that. And Kaletra has bad evidence. Acetemra, ACETMRA, acetemra is the only drug that I've heard besides hydroxychloroquine that has good effect. And Nicola, I've heard about interferon, alpha 2B. I've heard about IVIG. Again, people who love these drugs, I love all that data, but you got to understand IVIG, plasma, interferon. These are really hard drugs, not just to make, but to distribute. And you don't even want to talk about how expensive they are. Like hydroxychloroquine, do you know how much it costs? I know. A standard subscription only costs about $40 or less. It's not that much. There are antibiotics that cost more than that. Interferon alpha B, plasma, IVIG, even Remdesivir, acetemra, whatever, they cost like $1,000 to $10,000 each. Can you imagine multiplying that by the world? And I know they give a lot of Americans $1,200. Maybe just save it for the drugs. But my point is, it's not cheap. It's not cheap to make. It's not easy to make. And most people aren't going to be able to afford it. And how are you going to pay for it? Are you going to tell all of like the government and insurance companies that they have to pay for it for everyone? They're not going to want to pay for it for everyone. They're going to only want to pay for it for the people it works for. Like they're not going to use interferon alpha B or alpha 2B if you're just sick and asymptomatic. It makes no sense. It's too expensive and it's an IV drug. You got to go in to get an IV to get it in. There's no point to get it. So it may be good for sicker people, but we have to see what the data shows. So another article that everyone's been forwarding to me is about porphyria and hemoglobin and how maybe people are being ventilated too fast. This new idea that maybe we're putting people on the ventilator too fast. And that there's two processes in the disease. There's a disease process where in the beginning you get sick and you get what? Really short of breath. Everyone gets short of breath and coughing and turning blue. And a lot of people think that may be related because the COVID-19 virus, it's intracellular. It binds to the protein, right, of blood cells and other cells, even lung cells, and gets brought in. It gets like swallowed up and brought into the cell. And then there's a lot of theory, and welcome to Lisa, that hemoglobin and porphyria, the molecule that makes up heme and hemoglobin, which does what? Carries oxygen in the blood cells. There's a theory that the COVID-19 virus is affecting it, and that that's why hydroxychloroquine works, because hydroxychloroquine is like a malaria drug, right? And what is malaria? It's a disease where intracellular parasites go inside and attack the blood. So and welcome to my good buddy Austin coming in on Instagram Live. Thanks for joining. So there's this theory that it's a blood disease, and that's why hydroxychloroquine works, and that's why we need to focus on how do we fight the heme. How do we make healthy heme, healthy hemoglobin, healthy porphyria? Again, porphyria makes up hemoglobin, which makes up red blood cells, which carry oxygen. So maybe, for example, there may be a role for even blood transfusion. So Alyssa mentions a really interesting thing. So Alyssa mentions, do African Americans have a higher rate due to sickle cell anemia? Well, there's two debates about that. My friends, again, I don't want to mention specifics in hospitals, but my friends are taking care of a lot of sick minorities, including a lot of African Americans, and they do worse, and they die worse, and they tend to be poorer, but they also have higher rates of obesity and kidney failure and other things. But then there's the other side of the coin where you see a lot of people in Africa. Go to the population adjusted cases in Africa, right? And the population adjusted cases in Africa are way lower. And so there's a theory that why are they so low in Africa? Well, black people in Africa are doing well because what? Maybe they got the BCG thing. Maybe they take hydroxychloroquine a lot and the black people in America aren't taking hydroxychloroquine. So there's a lot of weird ideas. So again, there's the idea that maybe the first part of the disease process of COVID-19 involves blood. Maybe, for example, there may be a role for blood transfusion. That's just theorizing. Like maybe it's kind of like carbon monoxide, right? When you get carbon monoxide poisoning, you poison all your blood, you need to go in a hyperbaric chamber and like a lot of oxygen to get it out. Maybe we need to kick out the old blood with new blood. But again, giving everyone a blood transfusion is not realistic, especially if they're younger or not that sick. I mean, blood is blood. Even if all of us went and donated all our blood to the sick people, eventually we may need the blood, right? Maybe we'll get sick. And we can't just give blood to everybody because there's risk with giving blood to everyone. You can get diseases, you can get transfusion-related lung injury, you can get allergies, you can have a lot of problems. So I have a theory, and maybe it's a theory now, that blood transfusions may help the less sick people to prevent them from getting on the ventilator. Again, once they're on the ventilator, I've heard really bad things. That there used to be this idea that we do early intubation, and then all the damage comes from lung disease and a cytokine release. You may have heard this. What's cytokine? It's when there's inflammation and the cells all start exploding and releasing, or not exploding, but releasing really bad things, and that messes everything up. And that's why people get lung injury and these bad pneumonias and acute respiratory distress syndrome, and they don't look so well. So Nicola asked, do we use O2 enrichment machines through blood, such as during heart? No, that's called like ECMO. Again, extracorporeal, membrane oxygenation. So it's essentially like a kidney machine or a dialysis machine for kidneys, but doing it for blood. You can use it, but again, Nicola, this is really tough. I think we have like one machine or two machines in Hawaii. You're talking about ventilators being hard to make? ECMO is even harder to make. So it's not a realistic use. It is not going to be very useful for almost all of society unless you're what? A super rich country and a super rich hospital in a super rich city and a super rich patient within that that setting. So maybe there is a role for ECMO, but I haven't heard good data with that. They only use ECMO for the very sickest patients who are probably going to be about to die where everything else hasn't worked. So, and welcome to Layla coming in from Brazil. Layla, it's been a long time. Aloha. So that's some of the new studies. But again, there is this idea right now that maybe we're approaching this this treatment a little more poorly, okay? That we can't just intubate early, that we can't just give everyone hydroxychloroquine and do all that, that maybe we need to treat earlier with hydroxychloroquine or maybe even blood transfusions. Oh, and it looks like my Instagram Live may be ending soon. So I'm going to restart it as soon as it ends because unfortunately Instagram Live only works for like an hour. So if you're on Instagram, just my next live story will come on right again after that ends. So again, so that's about the new medications. Again, there's this other idea. If you listen to the ER doctor from Maimonides Hospital, I forget his name, but he had a very intense video about this being like COVID-19 being similar to respiratory failure from high altitude sickness for people like climbing Mount Everest, that they look like their lungs just blow out like pulmonary edema. So there may even be a role for acetazolamide or dexamethasone, high dose steroids. So a lot of people forwarded me articles about, do steroids work? Yeah, by the way, a lot of my doctor friends are using hydrocortisone IV along the same time as they're using like hydroxychloroquine, which is again anti-malarial, not steroid. There's hydrocortisone. That's an IV steroid that we also give to certain other people. And we give like methylprednisolone, like solumedrol to people with lung disease. It's an anti-inflammation. How does it work? It just reduces inflammation. But again, a lot of my friends using hydrocortisone haven't seen great results. But there's that interesting idea about whether this is more like high altitude pulmonary edema. But I actually think it's more related to, again, a blood disease. Maybe it is very related to porphyria sickness, malaria, like a blood disease, and not carrying oxygen. So again, that's why hydroxychloroquine works. We may need to use it early. We may need to start giving transfusions early. We really may need to do that. I haven't seen a single study. I've researched it. There's not a single study on that. So yeah, so Simon, checking in from Denmark. Welcome to Simon. Okay, Instagram guys, I'm gonna check in real soon, okay? So I'm gonna redo another Instagram live. I'm not sure how I'm doing this. Okay, so hold on a second, guys, sorry. Yeah, okay, so here I am again on Instagram Live. Welcome back to everyone. I'm back on Instagram Live again. I can only do this for an hour at a time. So Stacy, what does prednisone do? So Stacy, prednisone is sort of your basic oral version of a steroid. Hydrocortisone is also oral or IV. Prednisone is only oral. People get prednisone for everything from asthma to some people get it for any inflammatory condition, and it reduces inflammation. Like when we have people with asthma and we give them nebulizer treatments, which we're not supposed to do anymore because it aerosolizes people with COVID-19. You want to get them out of the hospital, you give them a prednisone by pill, but there's no things that I've seen that use prednisone for COVID-19. It's all, again, these patients are really sick, so we give them IV stuff. We give them IV hydrocortisone, or we give them, maybe there's even a role for dexamethasone, or Decadron, or solumedrol, which is methylprednisolone. These are all IV versions of steroids. So welcome to Simon again from Denmark. It's 2 a.m. there. And welcome again back to LaShawn and Daniel and a lot of other people checking back in. So those are the new drugs. Those are the new drugs that are, and theories that I'm hearing about. One thing I want to mention, there's a lot of like home tests that are, a lot of people are being not scammed on, but they're being told they're trying to order it for themselves to do it at home and they're not ready. So again, I know a lot of people want to test themselves at home. I heard about Celex and Everlywell, and again, they're authorized, but they're not FDA approved. So I think my understanding is a lot of these tests are only going to private physician groups. Maybe when they make enough, and maybe when the FDA approves it, they'll be available for you to buy, to mail to home, so you can take it from your own social distancing, self-quarantining at home. But they are not FDA approved. They're emergency authorized, just like Trump emergency authorized Ford to make ventilators and stuff like that. So the pros and cons about home tests is, I think that, I don't know how many of you can stick a thing straight up your nose or all the way back in your throat. I'm worried the home test will have a high false negative rate again. That's what I'm worried about. I think all those tests, those stay at home, whatever, none of them are going to be as good as a single blood draw, or maybe, again, a poke that will show IgG, IgM. Again, we want all to be IgG positive. Oh, that's another, Simon is saying that they are getting permission in Denmark to go back to work by April 15th. That's pretty wild. So again, Denmark is doing better, and so is Norway, even better than Sweden. And so, it's not just New Zealand, Iceland, and doing whatever. Simon, as I mentioned other podcasts, I don't think we're ever going to go back to normal until we get a vaccine. So the only time we'll be back to normal completely will be when the entire world has a vaccine. So I don't think it will be till 2021 or end of 2020. We'll reopen stuff, but like you're seeing, and I forgot to mention this, in China, in Japan. Japan used to be one of the best countries for COVID-19, but what's going on in Japan? They're starting to get an emergency bump. They're getting their second bump because they kind of opened up a little too early. So unfortunately, you're already seeing, again, Don't just look at New York. Don't just look at Italy. Don't just look at Spain. Look at China. Look at Japan. Look at Singapore. Look at, those countries. They're already hitting their second bump. They're dealing with their second time of quarantining, second time of social distancing that they need to do. You know what the average Chinese person, they were in self-quarantine for 76 to 80 days, almost 3 months. We're all going crazy. We've only done it less than 30 days. They've done it for more than 2.5 times this. And as they've opened up society, you have seen some of those pictures of the Chinese train stations and the everything else and how bad it's getting, how cramped it is. So, we're going to have second bumps, third bumps, fourth bumps. And I'm worried the most in the US personally about our bump in the fall with our new flu season. Not only do we have to worry about flu, but now we have to worry about COVID-19. And hell, maybe we're going to worry about COVID-20. I don't know when they're going to call it COVID-20 instead of COVID-19 anymore. And they may call it COVID-20 if it mutates. Let's hope that it doesn't mutate that bad. Right now, they've shown different strains, but they haven't shown that the new strains or new mutations are super sick and making a super death COVID or something, or COVID prime or COVID, X or COVID, worse. So I'm worried in the US, I am most worried not even about, our second bump or whatever. I'm worried about our bump for flu season coming in October. I really worry about the US again in October through December. I mean, the only reason it's not so bad is we have holidays then, so people don't tend to work all that much anyway. Yeah, so look at Agnieszka in Facebook Live. She mentioned she's in Singapore. And Agnieszka mentions that Singapore, the second wave, is bringing a ton of new cases. So Singapore is on their second wave. China's on their second wave. Japan's on their second wave. We're not even done with our first. So in a way, they're better prepared now. But it sucks for them because also China, Singapore, all these, they're going to keep having more bumps than we will maybe. Who knows? Again, until there's a vaccine, until there's a way to test. The first easy one is IgG, IgM. Denmark, Simon mentions Denmark is slowly opening schools, kindergarten, school, the 5th grade are getting back to school next week with some rules, but they have to separate 2 meters away. And 2 meters is what? It's more than 8 feet, almost 9 feet away. We still only have a 6 feet rule. So maybe we have to separate by, 9 to 10 feet. Again, the problem is, Simon, in a country like Denmark, where it's more room, and same thing like New Zealand, you have more room, you can do a 9-foot rule. In a city like New York City, it's really hard to do a 9-foot rule for people just walking on a sidewalk. How many of those sidewalks have you seen normal days in New York where anyone is walking even 4 feet away from someone, right? Or even 1 meter away? It doesn't happen. So it's going to be very difficult. Every city and every state is going to have a different way they deal with this. And every country will have a different way they deal with it. And even cities within countries. So like Paris is going to deal with it a different way than, let's say, the south of France or Marseille or, something like that. And Oslo is going to deal with it and Copenhagen is going to deal with it very different than a New York City or a Beijing or a Shanghai or something like that. And again, I'm seeing someone from New York writing that authorizing pharmacists to do testing at the pharmacies. So, I heard about that. They are starting to do some drive-through testing, I heard in New York, in the parking lots. I think it's CVS Pharmacy is doing drive-through. So I think that's great. If there's access for drive-through testing, that would be great. So you can do more of the nasopharyngeal testing. Again, I don't love this nasopharyngeal test. It's the best we got right now, and we have quick versions of it. Again, Abbott Labs has announced the quick test, 5 minutes to 15 minutes. You can basically wait with your car in a side parking lot, and they can come to you with your results, So it's good, but again, I want the IVG or IgM, IgG antibody test. The vaccine, like I said, will take a year. The IgM, IgG test, we basically have already. We just need to make tons and tons of it and figure out how to distribute it and who gets it first. That's what I really, really want. So I think with all that, I think I'm going to sort of start slowly wrapping up finally. I don't want to go to 90 minutes. So again, as I mentioned, I really want everyone to ideally cancel your Easter, Good Friday, Passover plans. If you are Jewish or Christian faith, and try to do all that online. I mean, use your Zoom if you need to, use your Skype and FaceTime, and go in and come in and do those sorts of things. Still stay away from all those crowded supermarkets. I mean, just use common sense. I mean, if you need to really get something or gas, or need to, I don't know about you guys. I mean, again, I have an electric car, but I barely had to charge it. I'm sure everyone's getting like 1 week to a gallon, or like 1 week to 4 liters or something like now, because no one's driving anywhere. So I don't think a lot of people need to go get gas right now. I think that's my personal feeling, I'm guessing, but from what I'm hearing, most people don't need to get gas that much. If you can exercise and you're still able to in your city or state, yeah, go ahead and do it and don't get nuts. I have a balcony. I tan out on my balcony. I may go surf later, only because I'm legally allowed to do it, and I go to the place where it's really far away. Oh yeah, Simon, man, I'm sorry, dude. So my friend Simon from Copenhagen and Denmark is worried about Tomorrowland being canceled. But man, Simon, I don't know, man. It depends what Europe decides, right? It's July, so I'm worried about traveling within the US by June. So I don't know if they're going to cancel it. And they can't cancel it last minute. They're going to have to figure out whether they cancel it in basically like May, I think. Maybe not even June. So hopefully Tomorrowland happens. But my guess is, Simon, that they are not going to, and they'll just defer it, and you'll get to go for next year or something like that, unless you want a refund or something. So that's it. I think I'll end with that. Please don't hoard, man. Please don't hoard, everybody. Please don't hoard that hydroxychloroquine and surgical mask, all this stuff. I don't have to tell you what you don't have to hoard. I mean, everyone should know what you should and shouldn't hoard. If you're hoarding food and supplies that are like to you to eat and whatever, and you really do need a Lysol spray or like a roll of paper towel. Again, I'm on my only still third roll of toilet paper, second roll of toilet paper, second and a half, after almost 4 weeks. So do you really need 30 rolls of toilet paper for a single household? Like maybe if you have a household of 10 people, or maybe if you're looking at 3 or 4 months, but do you need more than that? I don't think you do right now. I mean, again, I think we're going to finish our first peak, and some people are going to be able to get back to work in America. I think more people are going to get back to work in America by the early part of May. But I think, again, those shelter-in-place laws will stay in effect because, again, China and, again, Singapore, other people are doing it more. So that's it. Thanks again. We were a little, finally, only 75 minutes instead of 90 minutes or something. It's Aveline. Hi, welcome. It's Aveline. Welcome to my Instagram live podcast. But again, you can check this all. I'll save this on my stories. I'll save this on my Facebook. And again, you can find me on my website at www.thetravelingdr.com or www.facebook.com/thetravelingdr. I'm on Instagram at thetraveling_MD, or also here at The Traveling Bachelor. And again, I'm on YouTube and Twitter. Just search for The Traveling Doctor there, okay? So share it. Again, I'll be doing telemedicine soon, so you or your family members or friends can personally consult me, and I can even write work notes and call in medications to certain states in the US. Again, I'll be able to do it for Hawaii, for Wisconsin, for Indiana, Delaware, New York, and I forget where else, but a bunch of states. So yeah, so that's it. And thanks a lot, guys. Stay safe out there. And please, just, stay safe, wash your hands, and aloha, okay? I'll see you next week. It'll be my last podcast next week before back to work, so it'll be harder. So yeah. Okay, guys. Until next time.